I'm going to actually have Jen come on, my wife, Jennifer Griffin, and ask her through the eyes of a spouse. And I think this is Jen has done a really good job. I want to brag on her. She's really kind of let me have my space, because we've talked about the shame piece of it. It's not something you want to talk a lot about.
No.
It's not something you want to even, you feel embarrassed that you have to spend the money. You almost feel a little selfish, right? You almost feel like, and so let's talk about that for a minute for patient. Let's do a session or a segment for spouses out there of patients that are going to have to go through this. What would you tell that spouse, or what would be a good, somebody's doing due diligence for their spouse on this and watching this, what would be some good advice or questions, or what would you like to say to them on a good, some pointers to walk through this well with their spouse that's going to have this procedure done?
You cannot be too supportive. You absolutely cannot be too supportive.
Yeah.
And if there's anything not to use your sense of humor for, in any form or fashion,
Right.
because there's not one thing funny about it. And I love to laugh. I love to laugh.
Yeah.
And I love jokes. We used to call them cruelty jokes.
Yeah, sarcasm is a love language in our family, for sure.
But when it comes to your mouth, there is really nothing funny about it. And you were talking about giving space. Giving space is a wonderful idea. And just, be there. You don't have to draw attention to it. Just be loving without even discussing the mouth. Just being loving and supportive. But don't be funny, or don't say, or ask too many questions as far as, well, let me see what they did, or let me see that. Don't do that.
Right.
If they want you to see something, they'll show it to you.
Right.
You don't need to you can be supportive, but you don't have to be as involved. Other surgeries, you need to be very involved. You need to listen, go to the consultations with them, and ask questions with them. But it's almost threatening, even with somebody as close as can be, because the mouth is as close to your soul as I can imagine.
Yeah.
It's I really and truly, and I guess that's why when we look at a person, that's what we see. The eyes and the mouth. So just know that you cannot be too supportive, and you don't have to be too curious.
Yeah.
Because if they want to tell you about it, they will. Be very curious at the consultation on asking the doctor.
Yeah, be in a second set of eyes to see if
be very curious there. That's a different deal. But you don't need to be curious as to what's going on. Just be supportive, please.
Yeah. I would recommend and say amen to that. And also, have the conversation of up front when you know that there's a challenge, where you just say, look, I'm for you, I'm with you, I know this is challenging, and I'm gonna leave it at that, but no, anything you need, anything, I'm here. And you just be kind of sensitive to when you need to help and step in, or they might be in pain and they don't want to show it. Give them some space, help take some things off their plate. You almost don't want to be, you almost feel like you're when you're in those pain, when you're in that mouth pain or that kind of stuff, you almost feel like you're a burden and you don't want to talk about it and you want to just suck it up. And so if you notice that, if you notice that your spouse or your loved one is in pain or wincing, or you see them flinch when they're eating and that kind of type of stuff, you don't need to bring attention to it. You don't need to, what's wrong? What's any of that? But just be sensitive, because it is real. And like Mom said, I've thought about it. I could lose an arm. God, I don't want to, but I mean, I could lose an arm. I could lose, almost lost an eye, you know? I mean, we went through that road, didn't we?
Couple of times,
huh? And I've thought, okay, if that happened, and I've seen people, and you don't, it's weird. You don't have that same reaction that you do when you see somebody that has maybe 3 or 4 teeth left. It doesn't. And when you have it, when it's your deal, you know, you're like, it's just, yeah, exactly. And you learn to smile without
Absolutely.
any teeth showing, and talk a certain way, let that lip hang over the teeth so they can't see it. And so it's real. Okay, we don't want to bang that drum anymore, but I just, you know, for the spouses out there, I just really got to thinking about that. And I'm going to let Jen come on and speak through the eyes of a spouse, because I know, you know, I also want to give credence to a spouse too, because they probably feel helpless and they feel they want to help and they want to, maybe they, like you talked about, joking about it, they think that might lighten it or make it less awkward. It doesn't, it makes it worse. But, you know, I think that's something that we're going to end up doing.